Call the meeting to order. It's 1:01 or close enough, 1 o'clock. I was going to say, should we do a pledge of allegiance, but we don't do that. Okay, so who's here to do roll call? Cody. Hi, Cody.
Hello. Whoa. Hi.
Cody, can you please do roll call?
Yes.
Thank you.
Member Baresh.
Here.
Member Williford.
Here.
Member Ibian.
Here.
Member Ramos.
Here.
Member Val.
Here.
Member Miller.
Here.
Member Antle.
Present.
Member Allman.
Present.
Member Moschetti.
Here, and thank you.
You're welcome. Member Bradley.
Here.
Okay, that is everyone.
Okay, next item is public expression for items not on the agenda. Do we have any members of the public that would like to speak? No. Okay, so let's move on. Item 3, committee matters. 3A, approval of minutes from our May 28th, 2025 regular meeting.
I move we approve.
Allman seconds.
Cody, can you
Yes, I'm sorry.
take the roll? Go ahead.
Member Williford.
Yes.
Member Baresh.
Yes.
Chair Ibiam.
Yes?
Member Ramos.
Yes.
Member Val. Member Miller.
Yes.
Member Antle.
Yes.
Member Allman.
Yes.
Member Moschetti.
Abstain, not present.
Member Bradley.
Yes.
Okay.
Thank you. Item 3B, August 2025 Measure B Financial Report. Recommended action to accept the August 2025 report. Is there any discussion?
Andy will do a quick presentation and then I'll go over it real quick for us.
Okay.
Good afternoon.
Good timing.
Yes.
I always pass the driveway. So we are finishing up the 24-25 year-end close. And the grant payments that we've received so far, that we actually received is about 3.4 million. And we are submitted another 3.4 million. So we're hoping to get that in the next couple weeks. And I just wanted to note that for the Measure B operation costs for this fiscal year totals about $50,000. When we close out, last year was about $112,000. So we saved some on the salary and benefit costs that we charge Measure B, and mostly it's the 887 charges that we didn't have this year that we had last year. And then the total expenses for the PUF, I wanted just to note this year so far, or that we are closing out as about 9.7 million is what was charged for the PUF this year. Few notes that I have.
I have a question. So you said grant proceeds 3.7 million?
3.4.
Those don't come to Measure B.
Well, they don't come to Measure B, but they cover the PUF costs. So it comes to Measure B to cover the PUF costs that we have, so the 3.4.
So to the doctor, the funds come to Measure B and then Measure B pays out of it?
So Measure B pays first. We show an expense and
I see.
then that expense gets invoiced to the grant and then the grant reimburses
Got it.
Measure B for those costs. Yeah.
Thank you.
Thank you, Andy.
Yep.
Item 3C, update and discussion regarding measure.
I'm sorry, do we need to make a motion
Oh.
to accept the financial report?
Yes, we do.
I'll make such a motion.
Thank you.
Okay, Member Baresh,
Yes.
Member Williford,
Yes.
Chair Ebium,
Yes?
Member Ramos,
Yes.
Member Val,
Abstain.
Member Miller,
Yes.
Member Antle,
Yes.
Member Alman,
Yes.
Member Moschetti,
Yes.
Member Bradley.
Yes.
Okay.
Thank you. Moving on to item 3C, update and discussion regarding Measure B related items at the Board of Supervisors meeting.
All right, we don't have any items that have gone in front of the board between the last meeting and this meeting, but we do have an item going in front of the board on the 9th of September. It'll be on consent. It is to ask the board to move forward with us releasing a proposal. As we know, at the last meeting, we voted to release a RFP for substance misuse services with our top 4 focus areas, with the addition of it being a facility that's not within the Ukiah area. That will be on consent calendar for the Board of Supervisors on September 9th for them to approve the Behavioral Health Department to move forward with releasing a request for proposal for substance use services using Measure B funding. So that's the only update I have on that today.
So I have a question related to the RFP. Do we have a dollar amount stipulated in the RFP?
We decided not to stipulate a dollar amount. If you remember, what the committee voted on was not to stipulate a dollar amount. We know that the Kemper report had recommended 10% of the Measure B funds be used for substance misuse treatment services or facility, and so we were going to see what proposals we got in and make decisions that way.
Great. Thank you. Any other comments, questions?
Different projects regarding this training center, the different programs that the Measure B funds have currently been used on, that we voted and the board approved for use on those programs. It's in the report. I'm not going to give an update on the psychiatric health facility because we have Doug and Kirk here to talk about that with item 3H. But if there are any questions about any of the current projects that are in the report, I'm happy to answer those. As you know, we originally funded a mobile crisis response team with Measure B funds. We were thankful. We had to use very little of those funds because we applied and received a very substantial grant that was able to cover the mobile crisis response for 3 to 4 years. And then the state of California moved forward with having those services be able to be reimbursed by Medi-Cal, but it's a different model. The mobile response that the state of California put out doesn't align with what most evidence-based practices across the United States. The state of California went with a non-dual response model, which is a mental health, 2 mental health workers or a mental health worker and a peer, where most states across the United States, they do a dual response model of law enforcement and a mental health worker. So California moved forward with a kind of a crisis response model that doesn't include law enforcement. You have to have 2 workers that go out together to be able to bill that Medi-Cal beneficiary. One has to hold a 5150 ability to write a 5150. The other can be another counselor or a peer, really pushing towards the peer model. But we were able to bring that, and it is a mandate, and we've been rolling that out in Mendocino County. So sort of moving away from that dual response model for the crisis. We still do work with law enforcement very close. They still go out with calls with us as needed, but we're really moving to what the state model is.
All right.
I have questions. And how is that affecting I hate to call them grants, but the money that we're paying to Fort Bragg and so forth, is that lowering our cost and our obligation?
For a crew?
Yeah.
Crew is a different model. They don't do the crisis response the way they don't bill Medi-Cal for their services, so it's not impacting. Crew uses grant funds, and then obviously the funds we gave them through Measure B to fund their system. They don't use a Medi-Cal billable model.
So they don't use any of your employees?
They don't use any of our employees to do crew, no.
Okay, thank you.
Okay, do we need a recommended action? No? No? Okay, item 3E, update and discussion regarding use of an LVN versus an LPT.
So I was hoping to have some additional information from ResPad. We weren't able to get their full report, so I'm going to suggest we carry it over to the next meeting. I am asking them, I know that Member Almond has been working with the Mendocino College about an LPT program, and so I was pushing on ResPad to get us some numbers on what that would look like for them to use LPTs versus LVNs. I know they pushed a little bit back that they prefer LVN, so I really want to have some numbers that we can talk about locally. What would those numbers look like, so that Member Almond might have those. I think he's attending a board meeting with the college. And so my hope was that we would have some numbers of what that would look like in Mendocino County.
And if I can continue on with that, thank you. So let's remember in 1999, if you lived here in Mendocino County, the reason that our PUF closed is because the acting director said that staffing was inadequate and it was not possible to hire the staff to adequately staff the PUF. And so the PUF closed. Decision made in December of 99, it closed in January 2000. And when Measure B passed, I met with then college president Reyes, who made a verbal obligation to me that he didn't keep, that the college would start a licensed, LPT is licensed psychiatric technician program that would allow CNAs and LVNs to actually become licensed psychiatric technician. And they were not going to have to reinvent the wheel because Napa Community College has such a program, and President Reyes left untimely from the college, and as such, no direction was given to the college for such a certification program, even though we were told somewhat that it was. So I did attend a college meeting last month, and I explained to them my personal dissatisfaction of making obligations that were not kept, and they are very much supportive of working with the doctor, with Dr. Miller, and determining if we are going to need LPTs to staff the hospital. Remember, let me tell you what an LPT is. LPT is an $85,000 to $97,000 a year job. That's the industry standard according to Indeed in California. It's a decent job for a certification. So this is not for an RN. And if we are on track to open up the PUF early next year, which I think we're going to hear later on, we are, our next critical decision, we don't have a decision to make, our next critical problem is how we're going to staff it. Because if we can't staff it, then our business model is out the window. And I hope that everybody in here understands the significance and importance of getting qualified people to work the PUF. And just like in whatever your occupation is, I'm going to guess that somebody in your business or job has said it's hard to find people here because they can't find decent and livable real estate, and they won't move here because their salaries aren't going to allow them to move there. And so one of the purpose of working with the college is to get local people trained so they're not going to have to worry about finding new housing. But this cog of the machine is missing, and I'm not sure, one second, Doc, I'm not sure where we are going to go. I don't even know what difference we can make unless ResPad, who's going to be running the PUF, makes a decision to staff at a higher level. But remember, if LVNs and RNs run this as opposed to LPTs, the staffing costs are going to be much higher. And we have a business plan that we need to prove to the voters that this PUF, while it might lose some money, we don't want it to lose a lot of money. And so this is something really and truly that we should have on every agenda from here on out until the problem is solved. I'm sorry, Doctor.
What was the college's response?
Very supportive. Matter of fact, they're meeting on the coast next month, and they're going to be, Tim, the president, is going to brief the board regarding what Napa has. However, a lot of it is going to depend on Dr. Miller's answer from ResPad. Is that how you say it, ResPad? If they're going to require LVNs or RPT or LPTs, because LPTs are much cheaper, and obviously if it's cheaper, it's going to lower our costs. So I don't know if you found out anything from them or not of what they're going to need.
I'm asking for more detail. They said that they will use LPTs. They prefer LVNs because they can do more than an LPT, so it gives them more viability. But I'm also looking back about what do those numbers look like? If we had an LPT program, would you take them? And what does that look like? Because we do have an LVN program, but we all know there are not enough nurses to go around, right? So this would add an additional workforce option for them. And so I'm continuing to work with them to say, what would this look like if we had the LPT program? How many would you hire? I know that there had been conversations that maybe even Anchor within their clinics and stuff could possibly use LPT. So I want to kind of get a number, and then I think Ace, you've heard that, right, about LPTs for Anchor. Yeah. So I want to kind of figure out what of our providers locally would consider LPT, so we get a better number than just ResPad.
So let me tell you what Napa Community College has. They have a fast-track LPT program where a person with no medical experience can actually start a fast-track program, become a CNA, and immediately go into LPT, and it's less than a 6-month program.
Wow.
I know, wow, that's right. And so I'll be very blunt with you, and what I told the college is they're getting ready to put a ballot initiative again on the ballot for voters to support the college. And I assured them that I, as a retired sheriff, will never support this, and I'll go against it unless they can come up with an answer to our problem. Because this is the biggest problem Mendocino County has right now of behavioral health. And if we can't staff a brand new PUF, then all the work we've done for the last 10 years is moot. It's absolutely moot. It's why are we here? So please, this is not a decision on whether we're going to have a gun locker or not. Like we've had many, many decisions in this room. This is probably the biggest decision we've had, second to accepting a contract for the PUF. If I sound very emotional and strong about it, it's because I can see the train on the track for the headline saying that the PUF is finished and we can't put anybody in there because we don't have a staff.
So I have a question. Ace, do you have a question? You go first.
Okay, first of all, Dr. Anderson is a psychiatrist that works out here somewhere. I've heard his name.
I'll let her answer that. I don't know.
Dr. Anderson, did I get that right? Dr. Miller, I'm sorry, Miller. Who is he?
On the coast?
No, a psychiatrist, is there a psychiatrist name? No, I heard that.
Well, there's Richard Miller on the North Coast.
Okay, yeah, I know Richard Miller, yeah. So the other thing, gosh, it seems like just that there are all of these people who are coming out of addiction that are looking for jobs that would be perfect for something like this. And, I was just thinking we could give some sort of a grant for people like that to go down and take the course and come back. Seems like.
I invited the college to be here today. I don't see anybody represented from the college today, but certainly what the doctor just said regarding a grant, I think that it wouldn't be an unreasonable conversation for us to have that if this college doesn't offer a program for LPTs, then it may be something we could do to offer some kind of grant for people to go to Napa and have that 6-month certification to where they can come back and live here. So it's certainly something to think about. I have a few balls in the air myself. I don't have time to put that together. But
it seems like even if they did do this, it would take some time to get this up and running, and we're going to need people before that.
that's why I've talked about it so much, Doc.
I hear you. I hear you.
So my question is, does the RFP delineate what the proposed staffing would be? Is it laid out?
They do delineate in the RFP their cost for LPTs, right? They didn't say absolutely not. They said we lean towards LVNs, but of course, we would look at LPTs. So I'm pushing back to say, if you were in that model, how many would you need? That's more my thing. The college needs to know that they have people interested that would want to attend the program and that they would have jobs locally for those individuals. I think that's one of the things they want to know. If they have people graduating, will we have jobs? And I'd like to be able to say between a couple different of the agencies we know who would be interested in hiring LPTs, that we would have job availability in Mendocino County for those positions.
One more question. Are we talking, how many, whether it's LVNs or LPTs, how many are we talking about to staff the PUF?
I don't have that right at my fingertips, but there's state regulations, right, by number of beds. As your bed count increases, you have to have so many staff per bed. So if you're only operating at an 8-bed, your ratio might be less than a 16-bed, but there's a staff ratio, and it's 24/7.
Right. So that's a huge, I mean, it's one, as Tom said, it's one thing to build the PUF, but I mean, we're in August and with, it seems like to get the staffing in place, ASAP seems essential.
Yeah. So, then Anchor's building the 16-bed
Sorry.
facility or has built it, and I don't know what they're doing to staff it.
They, last I knew, they weren't ready to open yet. They've had some delays as we have with the PUF. So I think their date keeps moving also, unfortunately. But I think at the Behavioral Health Advisory Board meeting that was just before this meeting, Anchor did present, they did say there's still a delay. They're thinking maybe September, but they're not guaranteed, but they're gonna start looking to recruit soon. So they're gonna be posting job postings out in probably the next couple of weeks.
I
What
know
was
there are people
reported.
that are working already.
Yeah, they have moved some staff over, especially from their med management clinics, have moved over, but there's still some pieces, I think, in the administration and the main MHRC, Mental Health Rehab Center, that they still have to wait for the construction to finalize. But they had planned to open, I think, earlier this year. I mean, the date keeps moving. April, and so it keeps moving. But it's really, we contracted with a provider. It's not on the county to find to say, here's who you're going to staff. But it is on us to work with them on this. And they do run other facilities, so they're very familiar with operating facilities and getting staffing and meeting their staffing needs. This will be the first time they're in Mendocino County, but it's the first time we've had a contractor operate a PUF in Mendocino County. The county operated it last time. So that's why, we are at the table asking if we had an LPT program, how many would you use? What would that look like? And then obviously, what does that look like for LVNs?
So are they responsible for actually hiring?
Yes.
Okay.
Yes.
Okay. Joe?
I have just a question, it might be one for them. In veterinary medicine, there's a hierarchy as who can do what jobs and who can give direction, and there's probably that in the medical field. If they have LVNs and then they have LPTs, I mean, if they have one who gives direction to the subordinates, would they need to have all the the LPTs? Would they all have to be LPTs, or could they have like?
No, they can have,
supervising?
right, they can have a structure, because they're probably gonna have requirements for RNs, right? RNs can only do certain things that LVNs can't do. LVNs can do certain things that LPTs can't do, right? And so they can have that hierarchy structure, and that's the conversation of what would that look like in the model if they were to use more LPTs?
I know they have a nursing director already sitting in her office there. This one.
Oh, an anchor?
Anchor,
Yeah.
So I appreciate everybody taking this seriously, and I would ask that it be put on the agenda for next meeting.
I second that.
All right.
Carrie has a
She
question.
speaks.
Carrie's
I
had
did
her
have
hand
some
up.
Sorry.
questions.
Gary?
So forgive me because this is my first meeting to attend, so some of my questions might sound stupid, or I don't know. Anyway, so have this company have they been contracted to put the employees and take over management responsibilities for the facility south of town? Have they signed a contract?
They have not signed an official contract. They've signed, we worked with them on a memorandum of understanding. They did the RFP, they've agreed to do it. They put their letter, we sent our letter of intent to contract with them. We went into a memorandum of understanding with them because at this point, we're not paying them. A contract would usually have contractual terms of how much we're going to pay them. And as we know, with any inpatient facility, usually the costs go up yearly. And so to put a price tag in for today's prices would not be the prices when they open up in 2026. So they are on board. They have said they'll be here. We have a memorandum of understanding. Once we get closer to an opening date, we will then work on the actual financial part of the contract of what is it going to cost per bed.
Have you seen any advertisement that they've done for these positions?
They have not yet that I have seen. I know that they were doing, when I last talked to them, they were looking for some of those higher level positions. They were kind of doing some outreach. We referred some people to them that were wanting to move to the area for some higher level positions, like a director of nursing and stuff. But I know they're also pending, when is it going to open? Because they don't want to have people sitting there. If it's not going to open, which is, possibly April or May of 2026, I'm just throwing out a thing, we'll hear later, then you're looking at having to pay salaries that you're not going to have any reimbursement for.
I don't personally feel like it's too soon to start advertising those positions are coming available. Obviously, the salaries won't start until they start, but people have to make plans and changes and find housing to live in and so forth. So I think it's not premature to start. And I do agree with Tom that probably one of the biggest issues here because I got introduced to this issue recently, that this will be a really bad PR for this Measure B committee, and not that it's everybody's here's fault, but this will be bad to the public to know that we've got a facility that costs a lot of money and it's going to be finished and no one to man it. If that happens, I think that would really, really be bad PR on both of the facilities. So I think it's urgent that you figure something out, and if they can do RNs and have some, you probably, as I told Tom when I visited with him, I think you're going to have to bite the bullet to get going and maybe start with a little higher level just to get the doors open, and then you can adjust accordingly. But this would be really negative for the public to have this happen.
I know that they are committed to, and they have staff from their outlining offices. How they usually, my understanding is they'll bring in their workers from their outlying facilities to open it. Most companies do this, right? When you open it, they already have their trained staff to come in. They open it with their trained staff as they slowly add staff on, and this is kind of what their plan is, and then because they want their good trained staff to open it, right? And they're also willing to start before it's Medi-Cal certified. That means it could impact cost, right? Because then we'd be paying and not getting Medi-Cal reimbursement, but they have said that they're willing, as soon as the door is open, they'll start if we want, knowing that we can't get a Medi-Cal reimbursement. So I know they're dedicated to starting as soon as we say go.
When you say AR, that's
RestPad.
RestPad.
Yes, yeah.
And ResPad already runs 2 or 3 facilities. They've been doing it for years. And I know they've been refining it as they go.
But I can, let me just, and Darcy has her hand up, but I will talk to them to see, is there a way to start putting out that they're going to be looking for positions?
Great.
I can ask them. to
Maybe
do
put that, even though it's not a contract, you say, but your letter of understanding or memo or whatever, is to put some language in there that's what their responsibilities are, I mean, ahead of time.
It was in the RFP.
Was it in there?
Mm-hmm.
But they have responsibility if they don't find what is their recourse on them under your understanding if they don't find staff? As curiosity.
We didn't put a penalty in that. We could add it to the contract because the contract will start before they start, so we could add it to the contract.
Good idea.
Perhaps we could ask them to attend next meeting and provide an update and a plan.
Just in summary, so your understanding is that they're going to provide some LPTs to work here?
They would, I don't know about work here, they would bring down an opening crew, if that makes sense, that they would have some of their top people come in to start, to open it up. I know that they had a couple key positions they were recruiting, that they were looking for, and started putting out feelers for. They had asked us, if you know anyone, please send referrals our way. These are some big positions we're looking for. So I know they were already doing that, and with the plan to have their big, their main openers come down and open this facility. They're still going to commute. They still plan to promote here and hire from within the community. And we've asked multiple times, we're a rural community, our housing market is not fabulous, it's hard to find housing. Are you prepared for all of that?
Is it possible to get updates from them, let's say every 2 to 4 weeks? I mean, it's one thing to have someone come to a meeting, but just so, for me, I would just like to get an idea of how things are moving along.
I can ask them. I think the problem is they're waiting for us to give them an actual date, start date. But I can ask them if they can give us, like, have they hired anyone? Have they identified people?
Yeah.
Some of it's on us because we haven't been able to give a firm, yes, you get to move in April and start opening.
Right.
Right, the date has been, because of delays, and they'll talk about them later, it's been kind of a moving target. And so they're just waiting for us.
So, Doctor, why don't we just invite them to the November meeting? And that
Yeah,
way
that's what I'm
they'll-
gonna do, yeah, I put it on
So they
here.
will be here.
I will ask them, I'm sure they will be, they're
Perfect.
great. If not, we'll get them on Zoom at least.
Okay, thank you.
It would be nice to know if they would want us to find people here that would like to take the education, because I'm sure that there are people available. It'd be nice to know we need to find a certain number of people.
Yeah. I'll ask them, and I'll ask them to be here in November for sure.
And I'm just concerned that you said they need an opening date, but I don't know how close the opening date will be to when they're told the opening date is. And so there just seems to be a lot of footwork to do before any opening date. That's all.
That's the moving target we're
That's,
talking about.
I know.
We had a date, they've been back ordered, and that's why these gentlemen are here, to tell us what's going on with that, and we asked for them to be here. I just know that having opened veterinary hospitals and all this other stuff, once we get the building done and it gets an occupancy, and then we still have to wait for the state to bless it. I mean, this is tons of moving targets that are outside our control. And Dr. Miller does the best she can to get these people to get in line, but if there's no line of ducks, how are we gonna get them in? And we don't have control of the ducks. It's all outside our control. We can just ask for things and suggest things. And that is the one thing, and I'm not trying to put a damper on it, it's the reality of it. When you get into medicine and you get all these hierarchies of people telling you what you can and cannot do, and we can just push.
Sherry, can I make a recommendation? It might be beneficial to move 3H up, because we're kind of crossing into
great.
3H.
Great.
And
Good
so I
idea.
would, if we can I think we need a motion and a second to change the agenda, but I'm, okay.
Okay, there's been a motion to change the order of the agenda, move item 3H to follow item 3E.
Yeah, because I think we're moving into 3H already.
Yes.
And away from the whole conversation of the LPT was to talk about actually moving it to next meeting because we didn't have the
Right.
data, and we've gotten on, I think we got a little
Good.
off topic about 3E,
Okay.
but I think it will help it with 3H because that'll give us some time frames.
Okay, so there's been a motion made, it was,
Hold on, we went way too fast. We have a motion to
Yeah.
make sure this is on the LBN versus the LPT.
That's not the motion. The motion is that we're going to move the agenda item.
I know, but earlier we were talking about having it on.
We don't need a motion to put something on the agenda.
You don't want to make sure it's on there.
It will
That's all I want to
be. It
make
will be.
sure.
Oh, I do want to make sure it's on there, but I trust Dr. Miller to get it on there.
Okay, that's fine. I just want to verify.
Okay, question?
Oh, I was gonna note, you don't need a motion to just change the order on the agenda. You
Okay.
can just change the order on the agenda. It's
Okay.
agendized for today.
Okay, great. So let's change it then and move on. Yes, we're ready to move on off of this and on to item 3H. And update and discussion on the construction of the psychiatric health facility.
Good afternoon, Chair Abram and committee members. This is Doug Anderson with the County of Mendocino, got a new title, Capital Projects Manager, here with an update on the project completion for the psychiatric health facility. I did provide a written narrative for you guys, and I can kind of go over this quickly. That'll give us an opportunity to spend more time with questions and answers. But the original contract date for the project, and again, I want to make sure you understand, I'm talking about the project completion date, which obviously has to precede occupancy, and there are other factors involved in getting it started that I don't really have direct knowledge and understanding of. So I'm going to get us through project completion, and then, you know, the operation is I guess what you were already talking about. The original contract date was November 3rd. We've already experienced 10 delay days early on in the project when there were some difficulties with the soil. So the contract completion date right now is November 13th. We've experienced delays in delivery of the electric switchgear and the generator. As of now, we're looking at a projected completion date of February 27th, accounting for those delays in the delivery of that equipment. The delivery dates, as we know, are not set in stone yet, but they are improving. The previous date we had for the completion was closer to early May, but we did get a better delivery date last week that suggests that we're going to be able to finish up the contract right around the end of February. So I do have some narrative here on, you know, the nature of the delays and some of the responsibility for those delays. And of course, we can also address any other questions you have about you know, other aspects of the project, or, you know, what's going on with that project. But I think it's probably best to just keep this open to questions and let you guys ask the questions, and hopefully I can come back with answers that'll help you understand where we're going.
We talk about change order. Can I go? I'm sorry.
Yeah, go ahead.
Have there been major change orders that like this, and if so, have there been major costs associated with this?
There are several major change orders involved in the selection and approval of the generator per se. I don't have a list of the specific items here that have involved change orders, but we do have change orders at this point of roughly 3% of the project to date, which is, I think, $300,000, $350,000 at this point. It is likely to increase as we get closer to the finish, but that's what we're looking at this point. And the delays are really associated with delivery of the equipment that is specified. The generator change order was noted that the generator has to run both on propane gas as well as natural gas, and that wasn't clearly indicated in the contract document. So that was a change that required some re-engineering and planning to get the generator that will actually work under both both fuel sources. But that's not the worst of their delays. That's really on the electrical switchgear, which is the one that's going to be the last to deliver and holding up the project.
So I see in your report, on the top of the second page, you had, without mitigation of these delays, the completion date would be April 3rd. And then you outline mitigation 1 and mitigation 2, which moves the opening date up to February 27th. So can you explain how those 2 mitigations move the date up?
Yes, I can. The original schedule was based, that we got from the contractor after the delivery dates were identified, that would have pushed the contract back. Basically just took all the work that had to occur after the delivery of the switchgear and the generator and pushed it out to after the delivery of those pieces of equipment were going to show up. The mitigations were discussions that we had with a contractor that provided, as noted here, some temporary power and some temporary generators that might, whatever system would be the most cost-effective to allow them to work all the way through the finishes to get to where, when the equipment shows up, we're only doing the things that are absolutely necessary after that's installed, which is primarily the startup of the equipment, of the other equipment, and making sure that everything's working under the PG&E power once we get that established. The biggest issue with the electric switchgear is that PG&E won't energize the building until we have our main panel that has the meter in it. That's what we need to fire up the regular PG&E power to the building. And so PG&E won't even show up to put energy to the building until we have that switchgear. And so what we've done is we've pulled out all of the other work, the finishes, and the hopefully the startup of the heating and cooling systems in the building and other major processes that we can do with temporary generators and other equipment that'll keep the building going and keep the project going, so that when we get to having that equipment, we're just calling up PG&E, getting them to fire up the building, and then the last few things we need to do to make sure that everything's working after that happens. So what we've done is we've just made sure that the project completion, the building parts, are done with whatever measures we can do to make sure that that's happening without any other delays. So that's the mitigation that we've worked out with the contractor. And I wrote this initial draft before we met with our contractor last week. At that meeting, we did get an earlier delivery date on the equipment that bumped it up about 6 weeks. So that is the other thing that helped us push this completion date back closer to the end of February than April.
Gary?
Yeah. Will the generator not operate if the switchgear's not in the building? In other words, if PG&E is the problem to hook up electric, but for a short period of time to get just staff in there and start getting kind of trained and working through the building, could you not have the generator be the main source of power for the building for a short time? Not with patience, obviously, but just getting kind of started a little bit sooner?
Yeah, so I think that brings up kind of two questions. The first one, the answer is yes. As far as getting the work of the project done, it'll help us if we can get the generator installed and start working through some of the other project completion items prior to the electric switchgear showing up. We are looking into that. We hope that that'll be one of the options. Right now, the deliveries have gotten quite a bit closer together, so that may be less of an advantage if that switchgear actually shows up sooner as we've been indicated. But as far as trying to occupy the building prior to the actual completion of the project, that's something that we would need to work with the operator and the department to figure out, you know, what they're willing to do, how much they can do actually in the building before we actually are able to turn it over. Because we can't turn it over without the PG&E power as part of the, you know, online. So there
But
may
the
be.
building would, the building would run, because it's designed to run in emergencies with just a generator, correct?
That's true.
Well, call it emergency to get going in there, I'm thinking.
Don't the generators, I think there were 2 generators, if I understood correctly. Both those generators, don't they have to be wired into or through the switchgear to have the switch over? I mean, somehow they have to be able to communicate with one another, at least my knowledge of generators. My generator had to override from my electrical panel, and my understanding is the switchgear is like an electrical panel on steroids. So even if we had the generators hooked up, if the switchgear isn't there, would there even be that connection if it's the main thing in the middle?
So we have one generator. There are 2 sources of fuel for the generator, but it's one generator. So just to clarify that.
Okay, thank you.
And to answer your question, yes, the normal wiring of the system would require the switchgear to be in place and the generator wired into the transfer switch that is sensing the power source, whether it's on or off, and then when it's off, the generator starts automatically and continues to operate the building. The suggestion that we've pursued would require some temporary wiring system that would wire the generator directly into the actual distribution panels that run the different parts of the building, which would be at additional cost because that would have to be wired in and then pulled back out and wired the correct way to run the building the way it's designed. So if there is a useful period of operating the building on the generator, either for construction or for operations and, you know, startup, that would be something that we would consider. We would get the cost from the contractor on doing that temporary generator power and then discuss whether that's worth the cost at that point or not.
It would cost us more money.
There would be some costs involved.
Last question for me, Doug. You is, we paid Knox Lewis $2.9 million to engineer this building and to design it and everything. And now we're being told we didn't order the right parts for this, and it seems to me like through nobody in this room's fault, somebody missed the boat and we're still paid that we're being wrong.
So I'm going to assume the question is what's going on with Knox Lewis and our contract with them.
Question is, without throwing someone under the bus, if we're just looking for the truth, why are we in this position?
There are several reasons for this. I think that there's certainly some accountability on the part of Knox Lewis for not having more complete drawings when we went out to bid. The mitigating circumstances, I should say, for why we got where we got is that the system that the electrical system we designed has, you know, obviously the generator power in addition to normal PG&E power. We also have a solar battery backup system that is not so much a backup system, sorry, that is grid-tied solar system that supports, and the county's decision to approve and accept into the design the solar system was kind of late in the design process, and my assumption, without having any clear direction from Knox Lewis on this, but their electrical engineer basically had to regroup and engineer the solar system into the project late in the project. That I think is part of the cause of not having everything there as we otherwise might have if we had given them that direction early on. So I believe that that's part of it. I haven't really pushed them and tried to explain anything beyond that, but I know that was part of our process.
Chair,
Yep.
I just have a curiosity question. You said the generator was not the worst of your issues. What is the worst?
It's the main switchgear, the
Okay.
panel
I figured that
switchgear,
was it,
and
but-
that's, right now, we have a delivery date of December 20th for the generator, and now it's December 27th for the switchgear. Earlier, that was back, all the way pushed back to February. They brought that forward now, so they're much closer to the same time now. So hopefully, as we get into December, everything's going to start falling into place, and we'll be able to get the rest of the work done through January and into February, and be able to open.
Thank you.
So I said last question, but contractually, there's financial penalties for not opening on time. Are those, and I'm not, I know the contractor here, Kirk, I'm not trying to throw the dart at you, but legal is legal, and we've worked hard to get this where we are. Where are we on making sure the contract is abided by?
So I want to clarify, Kirk is with AECom. He's our construction management consultant who's been working with me as the day-to-day keeping this project going. He can probably answer some of these questions better than I have, but the contractor's not here at Midstate Construction, has been proactive and performing well throughout this project. The delays that we're experiencing now, in most cases, are outside of their control. Delivery of generators and switchgear have been delayed nationwide and worldwide since the pandemic, and now the tariff issues mean that people don't know where products are coming from. They don't know how much they can manufacture in what parts of the country or how much they're paying for these things. So just getting delivery on schedule, on time, has been difficult throughout the industry. It's very difficult to hold an individual contractor accountable for things that are outside of their control. So they're performing well under the circumstances, and there's very little that we or the contractor can do to mitigate those beyond what we can do within the contract, and perform as quickly as we can with what we have when we can get it delivered.
So this is a very state-of-the-art facility you guys have here?
I know, we're paying $35 million.
No, I agree. And the keys, I think the key to the, some of the issues that have come up is, I guess in the last 3 years, they passed a rule that you couldn't have one source of power providing a 24/7 facility. So there was new requirements that were put into place for a generator that can not only pull from PG&E gas, but from a separate supply propane. So those were kind of added in the design process of this project near the end. And that, I think, and then the generator that actually does that, this is the first project in 30 years I've been in construction that you have a generator that pulls from propane and natural gas, because usually you have primary electrical, and now you have gas, and now you got propane. So it's a very unique generator. So that caused some of the things, and we wanted to make sure we ordered the right part. So that review process and approval process to make sure we got the right generator took a little while, and we do have the right part coming in. It's a very sophisticated generator, and it will do a great job once it's installed and running. The other problems that Doug had mentioned was, over the last couple of years, fabrication delays are just huge. I mean, in the industry out there, we're looking at jobs that are 18 months out, 12 months out, because you're trying to get some unique piece of electronic components. They're all made overseas, and since we've been having issues overseas, we're the last ones on the list to get things, and so that's really caused a problem. The main switchboard was something that we were near the end of the design phase. We were trying to make sure we had PV, we had battery, and we tied into an electrical system, which you have all these different components that tie into that. And that caused to make sure that we got the right part, make sure we get the right switchgear. And I think that was a big part of it, because we wanted to make sure that we got the equipment that's right for this. We don't want to shove something in this building that you guys are maintaining and trying to redo every 10 years, So I think we did get all the right components. They're all coming in. Unfortunately, the fabrication industry out there is really like behind on a lot of things because of COVID and everything that happened then. So we've got it all into the building now. And I think it's going to turn out into an incredible building. It'll be 24/7 functioning. The one thing I wanted to comment on can you run off the temporary generator? Once we get everything up and running, the main thing we were looking at was we had delays because when you go into a building, we were supposed to finish in November. And we were looking at, okay, you've got a conditioned space, all the systems are running, you got nice warm space, you bring in all the finished products, they have to be conditioned, and you can install them all. So that's how the schedules are normally made. But when we didn't have conditioned space, okay, what can we do? We can bring in some temporary heat, warm up the building, and then we can put all the finishes in. So that's what we're trying to do as one of the mitigation items. And then the second item is, we want to make sure we get the electrical switchgear, the electrical main panel in place. But in order to occupy a building, you need a temporary certificate of occupancy, which involves fire marshal, county building department, all the other agencies, air quality control, and everybody that got to come into place. So the first time that the end user can use the facilities, when you start hearing, we can get you a TCO, and all that allows you to do is maybe bring in their office supplies, bring in their equipment, bring in some desks, and outfit the building. But it's not until you get the actual certificate of occupancy that you can allow staff or the public into that building to do work, because then the fire marshal checked it out for life safety and everything. So there is that whole process that's kind of hard to bypass. That's what construction's kind of difficult at, because you got to check the boxes before you get to the next step and stuff. So, and we are looking forward to working with the facility management company to start, crossing those things off on the list about what they need inside their computer systems, their desks and equipment and everything in there too. So that's all I had to say.
Thank you.
All right.
Joe?
Yeah, the only thing I want to say is that we have worked so hard to get this from the election to here. And I would hate that we get impatient and start pushing and we end up screwing something up. That's what I was trying to say about the generator and the switchgear. That there's certain things that have to happen in a certain order, and if we try to whittle around with it, we could be the ones screwing it up because of our impatience. And like they said, it's out of their control. The tariffs, COVID slowed everything down, and we've been doing this since before COVID. I just want it done right, and I want it open, and I don't want them to have to cut me corners to screw it up. That's my own selfishness.
So Doug, have I beat you up enough, or will you be here at our November meeting?
I can certainly be available at the next meeting to help with any other questions. We certainly will have a lot more information at that point in terms of when we're opening.
Everybody in the room wants the same thing.
Absolutely.
We want a good facility open to improve quality of life for mentally ill people in town. So we're pushing it because of promises made to the public.
Absolutely.
If I may, I would like to request that the item be first on the agenda, so staff can go back to the office.
You'd like to?
I would like to have this item first on the agenda at the next meeting.
Gotcha.
Because Tom asked him to come back.
Okay. All right, thank you.
Thank you both.
Thanks you so much.
Thank you very much for putting up with us.
Okay, so moving on.
Before we move on, friendly reminder, please unmute if you're going to speak. I want to be streaming the recording, do not hear you. Thank you.
Thank you. Item 3F, update and discussion regarding the first draft of the long-term financial plan. So you have a copy of the plan in your packet. Before though, I realized we have some new people here, and it'd be really nice if they could introduce themselves and tell us where you're from or what your connection is to our group. I'm sorry I didn't do that at the very beginning, but better late than never. So, Miranda?
Hi, I'm Miranda Ramos. I'm your 4th District representative. I live in Fort Bragg. And my connection to the work, I think, comes largely from my professional work. I work with the Alliance for Rural Community Health, which is a countywide network of all 5 federally qualified health centers, where a lot of behavioral health service and substance use disorder treatment services take place, as well as one rural health clinic. And so had the opportunity to work with the folks who are leading the organizations that help see to these services across the county. I don't know, is there more needed or anything else you should? Okay.
That's good.
Thank you.
Thank you. Welcome. Carrie?
My name's Carrie Vaugh, and Ted appointed me, or nominated me, I should say. And I live in Ukiah. I am the chair for the Employers Council of Mendocino County, also known as Mendo Matters. And I also have been a 7th generation Ukiahan here my entire life, with selling real estate on coastal and inland Mendocino County. Thank you.
Thank you. And there's no name tag, but Charlotte?
Charlotte Scott, County Council. I'm here really as staff to facilitate any issues you may have.
All right, well, thank you. Okay.
As an attorney, are you an attorney or staff?
I am an attorney, but I am staff. I'm County Council for the county.
Okay, thank you.
Okay, so I just want to, I'm going to go through this report, and it is a first draft, and all comments and suggestions are welcome. Just throw that out there from the beginning. So, page 1, there are our 8 projects. There's let me backtrack. The numbers in this report, I have tried to match the numbers that Andy sends out to us so that we are on the same page with the county that this report is, except for 1 or 2 places, and I'll explain where those places are when we come to them. But this first page, the budgeted amount at the bottom, the $31,684,000, that's the amount we have in our expenditure plan sent out from the county. You can see what we've spent through June. That should say August of 2025, because I did update it. This is what's allocated and still remains. And the last column, ongoing annual client costs. So I was giving that number 1.8 million for the PUF. And after hearing all of this discussion today, we'll see how that holds up as we go forward. But that's the number I was giving. That is the cost that Measure B would incurred that is not reimbursable. That's our out-of-pocket costs, above and beyond. And then the only other ongoing client costs we have are for the mobile outreach. A lot of the costs were covered by a grant, but we thought it'd be prudent to at least put a placement of $100,000 in there, not knowing the future of grant funding for that. So we did that. So the ongoing client costs are the 1.9 million. Okay, page 2.
Can I ask a question?
Sure, absolutely.
So does this, and Dr. Miller, you are out of the room. I think Chair Ebian was stating the 1.8 is an ongoing annual cost for client care at the PUF. Would this number take into account any of the new federal reg policies that have come up?
So the 1.8, if we remember, was an estimate thrown out based on what it was costing. When we first decided to build a psychiatric health facility, we went out and we spoke with a variety of different facilities that were running, especially county-run facilities and then some non-county-run facilities, to really look at their operating costs. In most county-run facilities, which was part of the additional issue, not only not being able to staff the original PUF in the county, was the cost to run a PUF in the county. Is that they always run in the red. Very few counties operate a PUF that runs in the black, because you can't get enough reimbursement, especially if you take in indigent or inmates, different populations we can't bill Medi-Cal for. And since you do have a portion of individuals that you will bring in that you cannot bill Medi-Cal for, you're always going to have a share of cost that could be a county fund share of cost. So the 1.8, I'm not going to say that it's something we've thrown around. It's not a firm number, right? Like, we're not saying it will be 1.8. I know that ResPAD has really, what I like about their model is that they really want to operate a PUF with their projections that it won't cost the county, right? That they're gonna run a business model that actually they work within the means of what they're able to bill insurance. However, that does not include what that does include is when someone doesn't have insurance, somebody has to pay, right? And so that becomes a payer source. It's a non-healthcare and payer source, but that becomes a payer source that will have to be paid one way or another. We health facilities, and it also, at that time, we weren't really mapping out what would this be if we moved to a not able to bill Medi-Cal for people who have a UIS status, unsatisfactory immigration status. Those would be a full cost, right? Someone would have to pay for all those individuals, and you can't say you're not going to hospitalize someone because they have a UIS. So that is cost that has to then be built into a model, right? What is your estimated UIS cost? We kind of have a thought process of how many individuals we think that could be. We just learned that yesterday, so it's not something we've looked at compared to our system. We know we have a 46% Medi-Cal beneficiaries rate in Mendocino County, so 46% of our population, give or take, are on Medi-Cal any given day, right? It fluctuates between 44, 46. So we do know that we have a high Medi-Cal beneficiary rate.
Just to equate that, that's over 42,000 people in this county.
So there are federal changes that would impact what we're projecting, what ResPAD has projected. There are potential changes in the financial numbers that we can't even say today, right? Because I don't know if they'll change the poverty level index, right? Which would then change how many people might qualify. We don't know if they'll hit us with an FMAP reduction. There's been conversations that some states could take a 10% FMAP reduction if they continue to provide services to individuals that are unsatisfactory immigration status on your FMAP or your FFP reimbursement, federal financial participation reimbursement, right? So there are multiple things that will go into how we fund and what we think. Is 1.8 realistic? It might be high, but I can't speak to that at this time. ResPAD's model is really trying to operate in the black or come in, but we still will have to be able to cover the cost of individuals that go into this facility that do not have insurance above what we've currently paid through with behavioral health. And I think that will change over the next couple of years. We're going to see a slow draw out as things change and how insurance changes and how what is being able to be paid. We also need to be prepared that just because the facility gets built, as soon as it opens, it may not be able to take Medi-Cal, right? You have to go through a Medi-Cal certification process. How quickly can we get certified? Will Medi-Cal or Medicare come in and want different changes? All of that will also mean that we may have a startup cost that is not covered by insurance if we open the doors before they're certified. And we want to provide people in county before they're able to get certified for those health insurance costs. So that's just a variety of, I just want to throw a variety of different things. I think we could probably lower the 1.8, but I can't guarantee that until we do a real analysis of it. But I think we also want to not get to where we can't pay it. So I want to be careful. We need a buffer. I think the reality is we need to see the first year or two of how ResPad operates to give us a real look at that financial. Are they coming in the, the red, or are they coming in at the black? And what does that allow us to do? And then be able to track what's happening at that federal level to see how it changes our reimbursements and what they might ask for. Because what they built their model on is what we're operating a year ago, right? And we weren't seeing some of the federal changes that are happening today.
Dr. Miller, I had a couple questions. ResPad, who are they currently operating, what facilities in their locations?
They're both called ResPad, ResPad Redding and ResPad Red Bluff.
But I guess I meant to ask the question of what PUF facilities in the state of California they currently, or are they anything in California they're
Yes.
operating?
ResPad Redding and ResPad
Oh,
Red Bluff.
I'm
Those
sorry,
are,
I
yeah.
didn't hear
Yeah,
you.
no, that's okay. They're both.
Redding and Red Bluff.
Redding and Red Bluff, yes.
Okay, and then you said that you have to be Medi-Cal ready. First of all, just to clarify, can anybody that has any other irregular insurance go to the PUF unit? Is it only Medi-Cal?
No, so one of the, as Kirk spoke a little bit about the generator change, right? One of the things that we really built this building on, and why it's maybe taken a little bit longer, is because we wanted to make this building to be able to be certified by private insurance and Medicare. Medi-Cal standards are less than Medicare standards. If you meet Medicare standards, usually you also meet all the private insurance standards, right? So Medicare has the standard that you have to have the 2 types of generators.
Okay.
Which was where that came into needing that additional thing, right? The laws changed. We want to be, what we really were looking at is being a super PUF, which was we wanted to be able to bill all types of insurance. When we looked